Why would you take people who have never lifted weights before and try to get them to do this exercises, grow muscle, grow strength, and then extrapolate that data to a completely different patient population? I think one of the reasons why people aren't compliant with plans is because they're not confident the plan will work. So at that point, there's not much you can do because that's all it is. All fat loss is.
Warning! You're watching Dr. Todd Lee TV, where theoretically you could learn a bunch of cool shit.
Well, hello there. I am Dr. Todd Lee, a medical doctor, and I am an IFBB pro bodybuilder. And I'm here to talk to you about how much progress can you make realistically in a year. A lot of people ask that question, and I think that they don't have a few things not like bottled down. It's like, one, how do you define realistic? And two, what is your definition of progress? I think that people have unrealistic expectations on progress because the scientific data is all conducted on untrained athletes. They take 20-year-old kids who've never lifted weights before and have them do leg extensions or something else, and the skill speed increases so fast that they get strong, not from increased muscle mass, just from the skill of actually executing the exercise. The same thing goes for a few other things like muscle mass, that they have dehydrated muscles with no glycogen. So of course their muscles are going to swell with glycogen and get hydrated quickly. That it's confusing why this is. Why would you take people who have never lifted weights before and try to get them to do this exercises, grow muscle, grow strength, and then extrapolate that data to a completely different patient population, people who've been lifting their whole life? Realistic progress. I think that realistic progress is about a half a pound to a pound of muscle a month for an advanced or intermediate lifter, respectively. So if someone was to try to mass build for 12 months, you can't. But if someone was to do that, let's not even look at that. A realistic off season is 6 months. So 6 months of just pure peak growth is up 3 pounds for an advanced person or 6 pounds for an intermediate person. Like, for example, I put on about 80 pounds of muscle in 15 years. So that is about 5 pounds a year at average. Was it linear? No, it wasn't linear. Some years I built more, some years I put on less. But over the span of like 2008 to 2020, no, from February of 2008 until February 2024, it's 16 years, I put on about 80 pounds of muscle. So about 5 pounds a year. Some years were better than other years. That's a realistic outcome. So when someone says, how much can you put on in a year? It's about, on average, 3 to 6 pounds. Because the whole year isn't a growth phase. Sometimes you cut for a few months, you do a health maintenance month, you start to grow. After the end of the growth phase, you do a health maintenance month, then you cut, and that type of thing happens. Or you might grow for 4 months, do 2 weeks of a mini cut, grow for 6 months, do a month of a mini cut. It's intermittent. Same things with weight loss. It's not realistic to try to lose weight for more than about 12 weeks at a time, and if you're going fast. So you could go maybe 2 pounds a week for 12 weeks and lose about 24 pounds, but then you'd have to cool your jets for about 2 weeks to 4 weeks and recuperate and then start the process over again. Sometimes not everyone's that sophisticated. They're not professional bodybuilders. So they don't have that much structure in their life. So because they're not doing a 100% perfect plan 100%, they're doing it 80% or 70%, then that extends the period. Like, you might be gaining so much fat that you can't even do 6 months of growth phase. Or you could be under eating so much that you could do 12 months of growth phase because you're growing so slow, there's no reason to cut it short from being too fat. Once you get over like 15% body fat, you probably should pull it down to about 10% body fat and restart your growth phase. If someone's gaining a lot of weight fast, like 3 pounds, like if they're gaining like 2 pounds a week, then that's probably mostly fat. So they're going to have to stop their growth phase after 3 months and do a mini cut and bring off some of that fat. I've had people say to me that they were in a cut phase. They were literally trying to cut, and they're like, I think we should do a mini cut. I was like, you're doing a cut. And they're like, well, what's the difference? I'm like, a mini cut's less of a cut than a cut. And they're like, oh. So you never really understand what's going through people's heads. It's like, what would really be amazing is if you were to follow the directions, then your cut would be effective and you wouldn't try to change anything to make it more effective because you would simply do what you're supposed to do to make it effective. And that's the part of the problem is I think one of the reasons why people aren't compliant with plans is because they're not confident the plan will work. They have no confidence in themselves, or they have no confidence in the person who wrote the plan. So they don't stick to the plan, or they just lack any form of discipline whatsoever, or they just don't want it, or they don't believe the plan is correct, so they don't follow the plan. They can't follow directions no matter what, even when their life depends on it. That they don't really understand things like details. They say things like, I'm not good at math, or I don't know the metric system. So at that point, that there's not much you can do because that's all it is. All fat loss is math. It's just calories in, calories out, weighing your food and sticking to your diet. Is you're supposed to have this many carbs, this much protein, this much fat. That's what you eat. I'd like to thank our sponsor, Fusion Regenerative Therapies, where I am the Director of Human Performance. This is the practice in which I practice medicine. We will be able to order you blood work and read your blood work and help you with therapy as needed based upon the results of your blood work. Please click the link to get a consult with me, and I can help you optimize your performance. Thank you. Now, with me and Dr. Karina Dotson, we work together in Apex Coaching. We will conduct a plan that you can be confident is 100% correct. And that way, if you just follow the plan, you will get results, whether you're trying to grow or cut. It doesn't matter, male or female. If I order your blood work, she and I review your blood work, the diet is constructed, and the micronutrients, not just macros, micros are chosen based on the blood work to correct any chronic illness you might have, like blood pressure, cholesterol, diabetes, etc. And then once someone's healthy, medicine could be introduced to help you achieve your goals if those goals were unachievable with nutrition alone. So for instance, if no matter what we do, your thyroid's not tip top, maybe some thyroid medication will be prescribed. If, for instance, your testosterone's low and the diet doesn't correct your testosterone, then TRT could be implemented. Same thing goes for other hormones, other issues. So whether you're trying to lose fat or build muscle, then it's all in-house. It's a doctor, two doctors. You've got your medical blood work. You've got your medical care. You have your nutrition, your training programming. There's spreadsheets to fill out so that the logbook is reviewed by me, and I will adjust your training volume, that the daily tracker on your calories intake, your water, your steps, your cardio is evaluated by Karina and I, and then she will make modifications to your diet to help you either adding calories or subtracting calories. Most of the time, the diets don't need to be changed. I just have to ride people like, you're not getting your steps in, you're not drinking enough water, you're not sleeping enough, you're not doing your cardio, you're not eating all your food, you're eating too much food. All that stuff is pretty much what the coaching process is. But when you have the integration of medicine and you have the integration of the coaching and the nutrition all in one, then it runs seamlessly. And so you know the plan, even if it's not 100% perfect for you the first time, it's still going to be 95 or 90% perfect. It's still going to be better than any other option. And then you can be confident that you can apply yourself to this. So 100% adherence to a 90% perfect diet is still 90% perfect. 100% perfect adherence to a 25% perfect diet is only 25% on track. That's not enough to make progress. So the plan's more important than the execution, and we handle the plan for you. So if you're interested in getting some help with achieving your goals, whether losing 2 pounds of fat per week, or whether it's gaining an appropriate amount of muscle, which is about 5 pounds a year, then get a hold of me. Click the link in the description box, and that'll take you to a different page that has at the top the option for consults. I believe it's flashing red, so you can't miss it. Get a consult with me, and we'll set you up for a program. Now, as this question was, how much can you expect out of a year of progress? The programs are a year long, and that's because of a number of factors. One of those factors is that it takes a year to see any progress, really. If you're going to do it right and you're going to actually put on lean muscle and lose fat, that takes a year, because a lot of people, they have to learn the metric system. They have to learn how to use a scale. They have to learn how to weigh their food. There's some women that are afraid of the scale because their body image is integrated with their self-worth. So if they see that the number on the scale, they associate inversely with their value as a person. So a 150-pound woman is worth less than a 100-pound woman in a woman's mind. This is not the case in men's minds. This is the case in women's minds. There's too many other variables like water weight, muscle weight, height, body fat percentage. The numbers don't tell the whole tale. And so that's why body image issues will get in the way of progress. And that's why doing it yourself, especially if you're an anxious person or someone with body dysmorphia or anorexia or bulimia, that's when you definitely need to have someone who's an expert help you through that process. So if you would be so kind, get a hold of me and I'll help. I will make that year as productive as reasonably possible. I'll try to get you as close to that 5 pounds a year mark or as close to the 2 pounds of fat loss a week mark as reasonably possible when considering the healthiest possible way. One thing I won't do is compromise your health to achieve a goal. It's strange how often anxious people will jump to an unrealistic negative possibility, even when they're contraindicated to each other. For example, someone might think, well, because he is a pro bodybuilder, I'm worried that he's going to be drug heavy. Nothing could be further from the truth. When it comes to your health, I wear the doctor hat. Or they'll say, oh, because he's a pro bodybuilder, I'm worried that I'm going to have too extreme workouts. That's not true, because you're not a pro bodybuilder. Why would I have you do a pro bodybuilder's workout when you are just a regular housewife who wants to lose fat, or some guy who wants to get rid of his dad bod and get a DILF bod? It's the same type of thing. It's called common sense and good judgment, and apply it. And if those things are difficult, we can help with that. We'll do all the thinking for you so you don't have to. So your anxiety can be in the back seat and we'll do the driving so that you don't have to worry at all about anything. Just execute the plan. Keep the car pointing in the direction the compass says, and everything will be okay. All right, thank you, and hopefully this was useful to you.